Now, every year, countless Kenyans endure devastating facial injuries from road accidents, injuries, crime, or domestic violence, leaving behind both physical and emotional scars. In these moments of despair, maxillofacial surgeons, though few in number in Kenya, become unsung heroes, using their skill and compassion to rebuild faces and restore hope. However, this is a very expensive undertaking in Kenya, and for many, access remains out of reach. Sadly, many have been left to bear the burden of disfigurement alone, as little is being done to support such critical care for those who cannot afford it. As the world observes International Oral and Maxillofacial Surgeons Day in this month of February, we talk to a maxillofacial surgeon who walks us through this life-changing surgery that restores hope to many. The devastating effects of severe facial trauma. Victims may suffer facial bone fractures or soft tissue damage, often involving the jaw, cheekbones, eye sockets or nasal bones, and in some cases, the head and neck. For those who survive, the scars and facial deformities can go far deeper than skin deep, often leaving victims disfigured and emotionally scarred.
I was attacked on the Southern Bypass on 28th December when I was traveling back from Bomet, coming into Nairobi. So once we were attacked, I was rushed to hospital where I had to have surgery done on my face because I had an attack where the assailant cut my face with a panga. I had to have a surgery done, and that's when the maxillofacial surgeon had to come and do the surgery on my face.
I'm a freshman in USIU, pursuing a degree in data science and analytics, and I also play rugby. We were away in Coast playing against the two Marines. I collided with a player, and I felt a bit of, something in my jaw, and that's when I found out I had a fracture in my jaw.
This is where maxillofacial surgeons step in to restore the appearance of patients, combining precision and skill to rebuild not only their faces, but also their confidence and quality of life.
The upper face.
Dr. Matthew Akama is one of Kenya's few highly skilled maxillofacial surgeons. He's also a senior lecturer at the Department of Oral and Maxillofacial Surgery at the University of Nairobi.
Luckily, the facial nerves, those are the nerve that controls, the facial expression. Luckily for her, they were not damaged. At the same time as well, this is what we call the parotid duct. The duct that brings in saliva from the parotid glands into the mouth was also not injured because they're actually around this area. And she's lucky that she didn't get, those kind of injuries. He was not able to close his mouth properly. He couldn't chew. He had pain. And there was signs of that area getting infected when he examined him. So the decision was made that we'll take him to theater. And his recovery as, care, really, I would say, uneventful. When you have this kind of injuries, really don't fear that when you come to us, you're going to get disfigured by the kind of surgery that we'll do. Our incisions, we make them in a way that you can hardly see them unless you're really looking for them. Like for him, we did it right down here in the neck area, and we were able to go in and put an implant, which is sitting in very well. And once he heals, really this scar won't be visible at all.
Kenya's emergency response systems often fall short, leaving patients without access to critical interventions.
Most of our patients in trauma are from road traffic accidents, motor vehicle accidents. These individuals, the patients sustain trauma elsewhere, and are going to be transported to the nearest health facility. Now, of course, it's key that these patients must be handled with care in a certain way that you do not aggravate their injuries. And it happens that in the facial region, as grotesque as some of the injuries may appear, they may not actually be quite life-threatening, except for those which may occlude the airway. So, of course, that has to be addressed as soon as possible. So, a patient has got other injuries elsewhere, the abdomen, to the chest, that has got to be addressed before you can come in and do, definitive care of the facial injuries.
Dr. Akama says a maxillofacial surgeon's priority after receiving a patient that has suffered facial trauma is to restore both function and appearance.
For example, if it's the mouth, patient that has lost part of the jaw,
yes,
you want to restore that function of chewing, that function of speaking, that function of swallowing. You also handle injuries to the orbit. We are talking about the bony orbit, what houses the eyeball, that we are able to reconstruct. Of course, now we work in conjunction with an ophthalmologist who take care of the eye. And in this area, I must say also it's a shared area that we also work very closely with other specialists, also work closely with neurosurgeons, especially when they've got craniofacial injuries, that the neurosurgeon then will take care of the brain as you take care of the bony part of the cranium.
In Kenya, significant gaps exist in access to maxillofacial surgical care, with many patients unable to afford the high costs, leaving them without critical treatment for life-altering facial injuries and conditions.
Affordability, we're talking about patients being able to afford the kind of implants that we may use to reconstruct these patients. We are quite dependent on using plates. That's what I'm referring to as implants, because you've got fractured bones, and the face has got very many bones which can be shattered. Or you may get a specific bone, for example, the lower jaw being involved, or the nose being involved. Now, to handle all this, you need equipment to use in theater, and you need these implants. So most of our patients are not able to afford these implants, and they're very expensive. They're very expensive that the hospitals are not able to stock them. So the patients are requested to go and purchase them so that then we can use them to reconstruct them. And that is the biggest challenge, and I hope that SHA will address this.
Maxillofacial procedures may carry side effects such as infections, swelling or scarring, requiring careful post-operative care to ensure successful recovery.
You may have, the eyeballs that have been pushed apart, and this patient, may not be able to see properly, may have what we call double vision. So those are some of the complications that you may have.
Okay.
They may lose, you have talked about loss of facial expression. If the nerve responsible for muscle facial expression is affected, that can be a complication that may arise when handling these kind of cases.
Timely access to care significantly improves treatment outcomes, minimizing complications and enhancing the chances of full recovery for patients.
The country is wide, and the maxillofacial specialists are not as many. And of course, looking at affordability for these patients to get to a tertiary institution where they can get this care, it may be a challenge. So they end up, healing with deformities. The bones, malunite. They don't, unite in the native position as they were, because they were not corrected, that the fractures were not properly fixed in good time. So that can be addressed. That can be addressed, but it's more challenging, to address such deformities after healing has occurred. It's better to handle these injuries before they complicate.
Maxillofacial surgeons not only treat trauma from accidents, but also address conditions such as tumors, cleft lips, and even perform beauty procedures to enhance facial aesthetics.
Patients, again, because I don't know, because of awareness, education level, they come late. Even with tumors that are non-cancerous. We can have tumors which are cancerous and those ones which are non-cancerous. So some of them will come with grotesque-looking kind of deformities, and we have seen them. You go to Kenyatta, you'll actually see this patient there. So these are the patients now that need, removal of those masses, and then reconstructing them. So these are some of the cases where if they could come early, you'll be able to remove the disease, the tumor, without causing much deformity.
Behind every scar is a story, and for many patients with facial trauma, maxillofacial surgeons become the authors of their second chance.
You cannot act God, but you always do your best to get the best outcome. So when you're able to get a patient, able to go back to their normal life, that's quite gratifying.
Through public awareness and affordable care, we can ensure that no one loses hope in their journey towards healing and a renewed sense of self.